All right, everybody, welcome back to the podcast. On this episode, we have a very, very special guest. I'm super excited to get to know her and her work. Kasey Ratliff. Kasey, how you doing, ma'am?
I'm good. How are you, Rich?
I'm doing fantastic. Like we were talking about off camera, I got some great coffee, and I'm just so energized by this conversation, this topic. And so with that being said, I'd like to just kind of ask you to introduce yourself and tell us a little bit about your work.
Yeah. So my name's Kasey Ratliff. I am a physical therapist out of Fort Worth, Texas. I graduated, I've been a PT. Every time I say this, it makes me feel older and older, but coming up close to, we're leading close to 20 years now. I have my master's and my doctorate, and graduated from UT Medical Branch, and after I got my doctorate, and literally knew nothing about physical therapy, meaning the schooling only gets you so far. And I think that's kind of really anywhere in life. When you get your formal schooling, what do you know when you start practicing? I knew how to measure some elbow flexion and some knee. And so I was like, what am I going to do with this profession? How I want to help people. How am I going to translate my formal schooling into something tangible and help people and be excited about it every day? So I started out on the grind and normal kind of an outpatient physical therapy. So think you have a surgery, your back hurts, you go to your doctor, they send you to a clinic, right? And that's kind of what my interest was orthopedics, sports medicine. How can I get someone stronger? How can I help their back pain? And I started on this path. I started taking a lot of continuing education with manual institutes. So a lot of mobilization, manipulation, soft tissue. And so I'm practicing like that for about 2 or 3 years. And I realized, one, my hands are going to get pretty tired if I keep this rate up. I was in a high volume practice, so I was seeing lots of patients a day, and I was not getting everybody better. And I was kind of like going, what else is out there? So I kind of stumbled into a clinic. Honestly, it was cold call clinic. I moved to Austin, Texas. And this clinic was one of the only ones at the time practicing this type of therapy, but I don't really want to call it therapy. I'll get into that. It's a science, really. It's science-based, called Postural Restoration Institute. So the Postural Restoration Institute was actually formed in 2000, but our founder, Ron Huruska, had been doing it way prior. So the Institute was actually established, but the ideals have been around for 40, 50 years. And I took my first course, and to say I was mind blown and confused and questioning my entire life was honestly the truth. Because I was like, wait, what is this? Neurological? Wait, what's going on? Because when I was in PT school, you had your neuro rotation, you had your orthopedic rotation, and everything was very separate, pediatrics and everything, and funneled out, right? And what are you interested in? And I remember thinking, I'm not really interested in this neuro stuff, right? And neuro in the normal layman term would be maybe post-rehab of somebody that had a stroke or a brain injury, right? And that's heavy neuro. So when I say neurological, that's not all I'm talking about, because I tell people all the time that have not had a medical stroke. We're still working with people that have had strokes, if that makes sense, because we're looking at the brain and how well we use both halves of our brain within our body. And so the Postural Restoration Institute, to me, changed my trajectory of my career. And I full-heartedly can say I don't know that I would be practicing physical therapy today if it wasn't for that. And so, so PRI is what you'll hear, kind of the acronym for it is for Postural Restoration Institute. Is the most challenging for me learning it was unlearning everything I thought I knew to be true.
What?
Yes, I know.
Wow.
I know. And I'm a psychologist major, exercise sports science major, athletic training, but psychology was my jam, and I wanted to be that. And so now I wanted to be a counselor. That's what I thought I was going to do. And I changed somewhere right before college because my dad is he's a hands-on aircraft. He was an aircraft maintenance guy, and he's like, why do you want to sit and listen to people's problems all day? And what's funny about that is I still listen to people's problems all day. There's no difference, right? I just can stand up a little bit more. But so the psychology behind learning something one way and then having to just reform and think a different way is what PRI does in my world for what physical therapy is. And so the Institute, we have a certification process, and we certify physical therapists, athletic trainers, chiropractors. We're not in a box. We're not just, you have to be this to go this. I have massage therapists, strength and conditioning specialists, occupational therapists, speech pathologists. I mean, it's huge because it's not discipline oriented. It's if you're treating a body and you have an interest in neurological processes, respiratory processes, brain anatomy, asymmetry, neurological processes. So your PRI is probably a good avenue for you. And everybody says, oh, well, it's complex. Well, yeah, the body is complex. It is. So I don't know how to simplify it more than not peeling back the layers and trying to really look at these humans every day. So is that a good intro to PRI a little bit?
Yeah, that's a great introduction, Kasey. Thank you for that.
Yeah.
Go ahead.
Well, so if we were to just do a big, I call it the elevator speech, right? Which is so hard to encompass because our institute, we have several courses. We have 3 primary courses, and I teach one of those. It's myokinematic. It's a hip course. And then we have a course that's broke down called Postural Restoration, and that's your rib cage course. And then we have a pelvis one. And those are kind of if you're off the street wanting to learn, those are our 3 primary courses. And so what are we trying to do with PRI? What do we want people to understand, right? And that's kind of the elevator speech is, I will tell you and this goes for everything, even if you're not looking at the body, is patterns. We want to recognize patterns in people. Is that patterns of thinking? Oh yeah. Is that patterns of how you breathe? Yeah. Is that patterns of how you sit? Yeah. Is that patterns of how you walk? Yeah. I mean, you could say anything about a pattern. That's what we're looking at, right? And we just happen to be a little hyped up on muscles. So we look at patterns of the body that are influenced by our muscles of our body. And it's not one muscle. We have chains from the top of our head all the way down to our toes that are influenced by this underlying dynamic of asymmetry, body and brain asymmetry. And so those are kind of the foundations when we look at someone. One of the first things you can talk about, and you can read research until you are blue in the face. You could read every day the rest of your life and never know enough about the brain, right brain, left brain. And we're all born with a left brain functional cortical dominance, every single human being. And that left brain dominance is what provides our body more motor points on our right side of our body. So then we start thinking about, well, then our right and our left sides are 2 different things. And they always will be. You'll never be able to make them perfectly the same because the brains are different on which they control. And those right and left brains are talking all the time, the cortices, but you still have this inherent dominance. So that's one thing that I think is to understand right off the bat when we're dealing with any type of human, whether you're a physical therapist, whether you're an occupational therapist, whether you're a counselor, whether you're a doctor, whether you're anybody, realizing that we're not playing with 2 halves. The brains do not perceive this body the same. The other big piece that when I was in physical therapy school, I only learned about what innervated it. And I did 2 years because I assisted in the anatomy lab, was C4, C5 keeps us alive. This is your diaphragm muscle. You breathe with this 20,000 times a day. And you've got a right hemidiaphragm, you got a left hemidiaphragm. They both come together and attach on the lumbar spine, but look at the difference in that size. And then on your right side, you also have a liver that sits right underneath here. So automatically you have 3 lobes of lung on your right and only 2 on your left because of the heart. So even that lung asymmetry, how you pull air in every single day, is different. So that right diaphragm is significantly larger. It helps to position us because your brain does not care, get air in, don't die. And it's not that the diaphragm moves the spine per se, it's the way airflow fills up into your body and into these lungs. And so that diaphragm attaches in with muscles above and below, your psoas being one of the primary hip flexors. And so that those chains are not even on the left and right side because of this inherent need to breathe every day, 20,000 times a day. And you can't sense your diaphragms. You can't feel your diaphragms. It's the muscles around it, the pressure sense from in and out that you may feel through rib cage, or that we're really trying to figure out, okay, what position is this person in that this pattern of asymmetry has caused, right? And I always call it over time, because we're seeing people I see all the way down to maybe a 6-year-old, but then I have an 86-year-old. So someone who's had more time on the planet to adapt, we're trying to really unwind and figure out, okay, wait, how did they get here? Why are they here in my office? Because they have low back pain. What caused that? Oh, you just bent over and your disc went out? Like, I don't think so. There's a pattern that underlies orthopedic findings. I'm not talking about trauma. If you get in a car wreck and you fracture something, or someone pushes you while you're playing football and hold your foot at the same time and you tear your ACL, right? But inherent things that happen in the body there's usually a reason and a cause for why we got there, right? So that's probably the big foundation when I think about PRI. And then how I think I can tie it into from the a therapy world and a counseling world is we are, and I educate every single patient I see on the nervous system, and we're influencing the nervous system. And so when we think about the nervous system, I think most of the audience in the world is really familiar with the central nervous system. So you have your sympathetics, which is your fight or flight, being chased by a bear. We want that to kick on. And then you have your parasympathetics, which is your chill, your rest, digest. We also want that to kick on. You don't want one running the show, right? You want them to ebb and flow and phase and be in a cycle. So most people understand that. We can influence that with respiration. And we'll talk about how, because we're going to kind of give some treatment pointers today about how we can influence the nervous system. But then the other one that I think PRI does a really nice job of understanding is the autonomic nervous system. And that's the one that's running in the background on all of us. And Rich, I can't change yours. You can't change mine. It's the one I'm born with. And over time, what has happened in my life, or what has happened in your life or anybody's life, that is going to influence how that autonomic nervous system responds. And so that's what's responding to the environment around it, whether it perceives threat. So a lot of patients that are anxiety, right? Which I think at some point everybody's probably experienced some sort of anxiety in their life. Those are your autonomics going, whoa, 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 we're threat. How do we bring it back down? And so when we think about the autonomic system, the autonomic nerve, I can't change someone's, but I can help try to influence it so that we can get that phasic motion again, so that the brain doesn't perceive threat all the time, right? And that is, you could talk about dizziness, vertigo, kind of putting the same thing, headaches, migraines, nauseous GI issues, dysautonomia. The umbrella is so large, but the part that's not threatening about it is if we can look at the why we get to these states in our body, emotionally, physically. And that's what I think, in my personal opinion, selfish opinion, PRI does an awesome job on really looking at the big picture and not just the whole human, right? Not just the body part that hurts or the neck tension they can't get to go away. There's a lot more going on with that. So those are kind of the big pillars when I think of, PRI and what we're looking at.
Yeah,
So.
awesome information. Lots of threads to pull on, Kasey. And I like to start with the imbalancing discussion or topic that you started with. And so from what I understand, we're born with imbalances. Like every human has an imbalance, a brain imbalance. We have a side that's more dominant, a right or left, whichever it may be. And I want to know, how is that connected to stress? Like when we're stressed, when you were talking about like when the nervous system is on flight or fight and anxiety, does that level of arousal like magnify the imbalance? And then what are some of the issues that come from imbalances in the first place?
So great. So when we think about stress in a body, right? Stress isn't all bad. Some stress is good, right? Does the brain know the difference? I don't know, right? We don't necessarily know if there's a perceived difference in sympathetics, whether I'm being chased by a bear, whether I'm being stabbed with a knife, like running from someone. But if you're a bipedal human, what does bipedal mean? We're on two legs, right? And if our brain, we have to use these two legs, we have to use these two arms to get ourselves through life, okay? So as one side moves forward in life, the other side should move back, okay? And we should have freedom everywhere. So our neck should be free to move. We should be able to lateralize, we call lateralize ourselves, shifting over from your right over to your left. And that's human gait. And arm swing has to happen too. When you see people walking without arms, always called dead person walking, I'm joking, but most people that I see walk in and don't swing their arms. And I'm like, you're not performing gait. You're literally just floating through space. There's no rotation going on. So what does that mean? Well, you can't compress and decompress on both sides of your body. So when you're walking and you're not swinging an arm, we'll just call it, I'm just trying to think of something easier. You see someone limping over to one side, as your body starts to not being able to use both halves, tension goes up in your system because you can't let go of something. Something always has to stay on because you'll fall. Does that mean people don't get over to their left leg? This is why I teach this course. Of course they get over to their left leg, but how are they doing it? Are they actually centering over from their head, their thorax, their pelvis over to their left side? And those are the objective tests we look at in PRI. We're like, where is this person? How are they doing the things they're doing? And so if you're not able to compress, decompress on both sides of your body, tension will go up. And what do I mean by that? So when I think about patterns of the body, quite often we'll see a right shoulder lower than a left. So the center of mass of a body prefers to be over on the right side of their body. Over time, this is all over time, processes change. So even visual space, visual field, if I always have my head oriented over one side of my body, then all of a sudden certain visual fields become a little less, we'll call it suppressed because of where I hold myself, where I feel comfortable. And now all of a sudden I have motion sickness. I can't read in the car. I can't ride roller coasters anymore. I always could as a kid, and or whatever that is. Well, yeah, now all of a sudden things that are flying by on one side because this half of your body never came back in space to appreciate space over here is stressful, right? And that is where stress in the body and the nervous system start to, it's really tension at the end of the day. You can't get out of your tension state. And that tension over time creates stress in the brain. You could call it anxiety. You could call it pain in a tissue. It's so encompassing, but it's from the lack of alternation in the body. Think about a car. You have a rack and pinion in a car and you hit a bad curb and you keep driving around on it. And your car's always pulling over to one side. At some point, those tires are going to break down. You know what I'm saying? And you're over there trying so hard and it's stressful to try to line this sucker back up. The difference is most humans don't even realize we're doing it because it's inherent to us. We open our eyes and we go, yeah, I'm in the middle of my body. I don't even know what you're talking about midline. And while we're on the topic of asymmetry, it's not a negative thing. And that's the thing where I want people to understand asymmetry is a gift, because if we were perfectly the same, we would be Lego men, right? And we wouldn't have push and flow. I mean, if you think about the digestive system, the colon's over on the left side. So you need it to be able to flow through your body. The problem becomes when it becomes too dominant and you start seeing these external asymmetries in people, that you've lost that harmony and balance, right? So you're always going to be a little imbalanced, always. I think you kind of said that. Yeah, you're born with it. But how do we find the best balance of the imbalance to keep the human organism in a more homeostatic, cyclical situation within themselves? And this is not just physical. This is emotional. This is mental. This is everything. You cannot separate the two. They occur simultaneously.
Yeah, wow. So it sounds to me, Kasey, please correct me if I'm wrong, that we're born with an imbalance and or imbalances, and the body has a natural kind of flow state where we're tense at once, and then we're relaxed, and we're navigating through space, we're operating. Our patterns of functioning, our patterns of moving should be such that there is a give and take, right? Like we're going, like you said, midline, we're going back over here, when we're shifting back over here, like in the example you gave of walking. And when we're not in that that normal pattern of give and take, then problems can occur. Is that a okay?
You could be my elevator speech guy. Yes, that's
Gotcha.
great.
Got
Yeah.
it. And okay, yeah, that's so interesting. And you mentioned the some of the issues that could happen. You know, like somebody whose head is kind of off to one side, just over years of this pattern of moving or being in this position, that that they start kind of their vision starts getting warped, and they start maybe seeing things a different way. And so I wonder, I just wonder, what's the number of ways that somebody's body can be impacted by being off this pattern?
Yeah. How much time you got? Yeah. I mean, you could sit with me all day in new avows and go, wow, 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 wow. Anything. You could tell me anything. And this is what I always tell patients. It's not that I don't care about your diagnosis. I care that you have plantar fasciitis on your right foot. I do. I really do. I care that your elbow tendon hurts. I care that your right neck hurts every single day. I do. But that's not always the problem, right? And I think that is the piece that I love so much about PRI, is we're looking at the whole body and not just the area. So, some of my diagnoses, I'm trying to think yesterday, I had a girl who came, I have people that come pretty far. So she was about 5 hours, and bilateral, meaning both sides of her body, hip flexor tightness, late 20s. She's had pain since she was 13 years old. Now she was 13. That's a long time to have hip flexors. She's been to PT, which helps, somewhat, and traditional PT. She had big horse gal, loves to ride horses, power tumbler from ages 4 to 12. So you start looking at what someone likes to do. She's a little bit of adrenaline junkie. We talked about it. And I kid you not, I wish I had a video, but we just got her in a position, right? Her rib cage. So these are your ribs. And my rib's a little broke here. I'm not sure what happened. But the position of this rib cage is going to really tell us how someone can use their diaphragm. And when we see ribs, I don't like the term rib flare because it just doesn't do much for me. You walk in and you go, oh, that person's in a rib flare. Okay, but what does it mean? We still have to test them, but it's a buzzy word, so I'm going to say it. So when these ribs are up, remember that diaphragm attaches here. It's a cylinder muscle on the inside. This strategy to get air in, remember, your brain doesn't care. Get air in, don't die. The pelvis follows what this guy's doing. What's the pelvis? Here's your pelvis. So you hear the buzzword anterior pelvic tilt. Both of those pelvises tilt forward. When you got a body that's living in this extended state, hello, sympathetic nervous system, constantly on, can't shut down. Ribs are up, pelvis is forward. It makes it really hard to get true diaphragm activity. Over time, you can see when those pelvis goes forward, those hip flexors get in a shortened position. The neck starts to overwork because our heads start to pull forward when your spine is in a more extended state. It's a great state to be in if you're deadlifting, if you're lifting a child, if you're picking. It's not a bad thing to go into extension. You need it. You just don't want to live there all the time. And so her ability to get her body in a more neutral state had nothing to do with hip flexor stretching, whatever. Put her against a wall, had her breathe, had her feel her ribs go down, had her breathe into the back part of her rib cage where your posterior lungs live, by the way, called postomediastinum. And she could barely walk when she was done, like shaking, like a new Bambi. And this is a power tumbler. This is like your adrenaline girl. And she's like, what's going on? And I wish I had a video because it was pretty powerful. And I see stuff like that pretty often. It's just that was the most recent. She didn't know how to use her own legs now because she figured out not to use hip flexors, she had to use some hamstrings in the back and how to kind of stabilize and move. And she was pretty mind blown. We made a suggestion, a change. We tested her body with it, but her footwear, and I want to get into footwear with your audience, because it's such a low hanging fruit that's very easy to change. I mean, it's literally so much as putting on a different shoe. And your brain feeds off of that neurosensory grounding from the shoe. And that alone can help this perform better. And at the end of the day, 20,000 breaths a day with a rib cage that's been extended, and we're talking about stress and anxiety, that'll take a nervous system off real fast, because it feels like it's in hyperventilation land. It can't fully get an exhale to get that reset of the nervous system. Does that make sense a little bit?
Yeah, absolutely.
Yeah.
And so, just going back to the client that you were working
Yeah.
with, the
Yeah.
Bambi,
Yeah.
so how did she get into that pattern? Like, was it just through her sport that over time she just got into that extended state?
Right. Yeah, I mean, I think she did choose activities that were more extension driven, but I'll tell you really what I see, and I see this a lot, is on individuals that are a little bit more lax in their bodies, and it's not rare. People say there's a real extreme, not real extreme, there's a diagnosis that is a little bit more rare. It's called Ehlers-Danlos ligament, but it's a spectrum. And I see, and the buzzword would be called hypermobile. And what I mean by that, it's usually a genetic thing you get from mom or dad, but your soft tissue is like, so here's the rubber band, we'll call it normal soft tissue springs back. If we have more of a loose connective soft tissue, it may not go back. And I'm not talking just about ligaments or muscles. We're talking everything in our body that has a slight contractile property, even the esophagus sphincter, that gets it may suffer a little bit from a lax perspective. She happened to be a lax human. So she was holding herself together with tension of her autonomic nervous system. Let that sit in for a second. Wait, what? Because her brain perceived threat. And that autonomic nervous system seemed, her hip flexors was the only place that she had stability. But the tension, because what I mean by that is some people can feel tight, even though they can bend over and palm the floor, because the tightness isn't coming from a muscle. That is a tension in your nervous system, right? And so our lax, our more loose connective tissue friends, or ones that may appear more double jointed through the knees and the elbows, I usually can feel kind of pretty dominant in the shoulder, or you have them bend over and touch their toes, just to kind of give a feel about where they are. Tend to have, I'm not trying to say this of everyone, but tend to have a more amped up autonomic nervous system, because now we're just dovetailing, which you and I briefly touched on this in our meeting, but the body lacks a little bit of interoceptive sense. So interoceptive sense can be, well, you could look at it as a normal definition. Oh, I think I'm hungry. That's interoceptive sense. Your body's kind of telling you something, right? And those are all tons of cues. I'm tired. Interoceptively, your body picks up on that. In my world, how I teach it, or how I like patients to be, where am I in space? What am I doing? Where am I? Am I on my right side? Am I on my left side? Is my head sitting forward? Like, just being a little bit more aware about what's going on internally. In the therapy world, you could call that mindfulness, right? Is that pretty comparable to some degree? Yeah. So, yeah, I'm trying to think what'd you ask me? Oh, you're saying.
Oh, just about your client and people holding themselves together with the
tension. Yeah. So, and that's just one, facet of things that I see on a regular basis. I work with athletes and some professional athletes too. So a lot of times we're even working on not getting out of pain. We're working on improving mechanics. I hate that term, but biomechanics, or improving their performance, right? And so a lot of times I'm like, I can't help you perform on the field or doing whatever. We can, but not legitimately. I'm not going to help you throw 100 miles per hour probably with my expertise. But if I can get you recovering and using both halves of your body better, you could call X, Y, and Z, and whatever you do in life is going to go way up, right? Because you're taking away roadblocks, impingements that, you know, may be keeping somebody from achieving that. So I say that to say that PRI, and I don't mean for professional athletes, I mean for people that aren't even in pain, is still a positive thing from a internal balancing, longevity type thought process. So maybe you don't hurt at all, but maybe you don't sleep well. Or, yeah, I mean, I do have some neck tension, but it's normal. I've had it every day since I was 14. I'm like, oh, okay, well, that's not normal. I always tell people common, not normal, these things. So you can work on all these kind of things without having a knee pain or an ailment, right? Because I'll have people that say, I want to optimize. What do I do? And you know how our sessions usually work. I see my clients once every 2 weeks. So it's not like come in 3 times a week. I'm not going to do much for you. I'm going to teach you. We're going to record it on your phone. I'm going to give you a handout, but you got to do the work over the next couple of weeks, because I can't, and just like you, Rich, like, you can't change someone. You can only give them tools, and then they have the opportunity to change. But if they don't want to, probably not my client. If they don't believe they can change, you know, so it's going to be, you know, help me help you kind of thing. But that's usually, you know, how the process of a PRI treatment goes, once every
Wow.
couple of weeks. So yeah, it's cool.
Yeah. Yeah, that's so interesting that that there are people out there who are on the spectrum with their ligaments. And one way that they hold themselves together is by tension. And maybe that could help explain or suggest why there's this adrenaline kind of behavior. Not saying that there is or that's the cause. I'm just saying that it could help explain why, like, there's this seeking of adrenaline, so that there's tension, so that they could hold themselves together. And by holding themselves together, things like this may happen that, you know, prevent the natural, like, ebb and flow of what you talk about, like our default healthy, you know, stress, tension release kind of cycle. Fascinating work, Kasey. I'd like to switch gears, if you don't mind. I'd like to kind of talk about the individual, like the therapist who is sitting in their office. They're in a chair, maybe sitting on one side, leaning on one side, maybe listening to the clients, or they're just sitting cross-legged, maybe even you know, with their legs out, but like ankles crossed. Because that's what we do, right? We're in our seats for a long time, indoors, you know. And so just kind of want to know, like, from with your training and your experience, what kind of effects happen to the body when a person is in that pattern for so long?
Yeah. So, yeah. Well, and I don't want to say sitting is the new smoking, right? Because we have professions that require that. And I treat a ton of people that sit for a living, attorneys or financial people. So it's not so much like, let's figure out how to meet the demands of the job, right? And how can we give, you know, as far as symptomology goes, it's all over the board, right? But the things I would be looking at on someone who I know is sitting is what can they do while in that chair, right? And to help keep balance. Well, the first thing, let's go ground up, right? First thing I would do is make sure they have a decent pair of shoes on, that they're walking into the office and out of the office. So say they need heels, they need a dress shoe while they're seeing clients. Okay, fair. They want to look a certain way. But from the office, or walking from the parking lot to the office, I would put a pair of tennis shoes. And we have a PRI approved list, which I think we talked about. We can attach it. It changes about every 6 months, but even having something underneath the feet is going to help that body stay a little bit more balanced. So, foot shoe discussion, you can research more about it, but ideally, the barefoot shoe mentality for me is not going to work for most of my clients on synthetic surfaces. I'm totally fine if you're on dirt, sand, grass, which just doesn't have to be most of us. Yeah, wear your barefoot shoe. Be barefoot. I don't really care, because your foot can actually naturally move. But on these hardwood floors, tile floors, we need something neurologically so the brain goes, oh, there's the ground. There's my heel. There's my arch. There's my big toe. And we have ways of testing that. I'll test it with clients, but even for your therapist, even just, you know, whatever shoes you're on, you can stand up right now and you can pick up a leg and go, do I feel my heel, my arch, my big toe? Okay. Yeah, I kind of do on that foot. Pick up my other leg. Wow, this feels a little different over here. And most people, the foot, it will be a little different. heel arch. And if you can't say that you feel both on both sides, you probably should look into a different shoe, in my opinion, to feel, balance. So for sitting, and if you're able to wear a tennis shoe, I would just be in a better shoe. Really low hanging fruit. I could tell you multiple stories about changing someone's shoes change their life. And I don't mean that take lightly. You could interview several PRI therapists and they tell you the same thing. And it makes you look like this rock star, and all you did was just be like, buy a pair of Brooks. Like, okay. The other thing, so when you're sitting, we really, depending on if you're vertically challenged, right? Either you're really tall or maybe you're really short, your chair is going to really be either helping you or hurting you. And I would have a stool underneath your feet so that while you're sitting, your knees and your hips are even, or your knees are slightly above your hips. So just get a little stool. It could be a box. It could be a couple textbooks, whatever it is. And I'm not saying to sit like that all day, every day, but instead of your legs not being supported and your knees below your hips, if you can see what that does, that kind of pulls you more in that anterior position. So then you're having to overuse kind of these muscles, to stabilize you. Because at the end of the day, I want seated people to be able to breathe easily. And the only way to breathe easily is to have that pelvis supported and your lower back and maybe a little bit of mid back. So as we work up the body, so I have a chair with a back here. Instead of, I've seen the trendy lumbar rolls. So people will put a lumbar roll in their lower back because we were taught, I was too, don't worry, that this is good posture, right? No, this is extension. And this is, you're not, trying to do a military position all day long, extended. When you're extended like this and you're pulling that pelvis forward, the lower back has to work. We shove a pillow underneath here. You can't breathe because your spine is too far extended. It's too far forward. That diaphragm attaches to it. It's got to be a cylinder, not a pancake. So what I'll have somebody do is just relax your lower back. So you can try it in the chair right now. If you put something underneath your feet and you relax your lower back, it's going to feel slumpy because of where we think we should be and where we've oriented our body. But as your lower back hits that, the front of your ribs drop down a little. Now, when you take a deep breath, you don't have to extend more to get that air in. That's a big deal when you're sitting all day. How are you breathing, right? So what chair you're in, super, super important. I would also make sure your chair is not cush where you don't have any feedback from it. Like, you're sinking into it. Something with a little give would be fine, but something with too much give or too hard. I know I sound like, what is it? Princess and the Pea. Trying to find, something in the midline for that would be really helpful. Ergonomics, I guess some of your therapists that probably watch this are on a computer screen. Is that fair?
Yes.
Like, do they do virtual?
Yeah.
Yeah. So, your setup, I wouldn't have my setup way, way up high or way, way down low. I'd have it an appropriate, nice distance. And if for whatever reason, the longer you're in the computer, you're starting to feel eye strain, eye fatigue, then I work with an optometrist regularly. Like, we text almost every day because he's sending me tons of clients, and I have to use him, and that's a whole nother probably podcast topic. But your visual system needs to be relaxed. You're going to carry tension there. And if you're having a strain to see, then you may need something to help kind of relax your visual system. And so one thing with people that sit and stare at screens is the 20-20 rule, 20-20-20. So every 20 minutes for 20 seconds, look out 20 plus feet so that you're using a little bit more of that further system versus this converge 3 feet in front of you. So maybe that, for people that have to sit, you get up in between session, you go out in the hall, look, focus out. If you have a window, some people don't have windows, but even looking out the window, right, would be, as I'm looking at one right now, super helpful on that. When we think about tension, just trying to kind of get the body to open up a little and not stay compressed. So those would be great, like, tips for somebody who sit. So and I think we kind of mentioned, I'll take y'all through a nice little exercise seated that I give a lot of my patients. And you can even do this standing. So I'm going to teach it seated, but it's the same concept. So just the background. This is called your posterior mediastinum. It's the posterior part of your rib cage. Your lungs live here. There's not an amount of manipulation you can do to get these ribs moving and sustain the movement if a person can't put air into the posterior lungs, okay? Because otherwise you're breathing like this. Oh yeah, I feel good when I get that popped, but then it goes right back. I was like, let me show you how not to have to get it popped. So the posterior mediastinum is kind of a precious area. Your esophagus, your descending aorta live here, but what's really interesting that live here is right along the spinal column, neuroanatomy nerds here, is your sympathetic nerve ganglion of your nervous system. So imagine if you have this mid back, which should be, this model is a little straight if you ask me. You should have some kyphosis, some rounding. That if we're not and we're constantly extending, we're just compressing ourselves in through our nervous system. So getting our bodies, and we kind of talked about this earlier, one side has to go back while one side goes forward. Well, if one or both sides are always forward, we can't get back. And the best way to get back is to get airflow back. Air moves us. And so what I'll have people do, and we can kind of do this together as we're sitting. So you have your feet supported somewhat. I want you to feel both of your butt bones, which means you can't be in a super cushy chair. And I want us to relax our lower back just a little so that we're not extended, that those ribs come down. So that if we were to take a breath in, we didn't feel that our ribs had to come up to do it, right? Because as we breathe in, we want to breathe into our lungs, not into our belly, into our lungs, our chest field. So then, chest walls. So then you're going to take hands on your desk in front of you. And all you're going to do on your inhale, and then you can hold it, is you're just gently going to press into the table as you push yourself back. So let's see if you can see my back here. This is a better angle here. So you're rounding your back. So it goes from here to here, but I'm pushing. I'm using a little bit of my muscles. You can feel my tricep, my serratus. Then from this position, I'm going to try to keep my head level. I don't want my head way, way, way down, just somewhat level. I'm going to breathe in. As I breathe in, I want to fill up the back part of my rib cage. So I'll have people do about 4 to 5 breaths at a time. So holding that, exhale, you'll start to maybe feel something tighten up on your outer abdominals, on your outside of your abdominals. Those are called your obliques. And you'll take another breath in. Breathe in, feel the expansion, exhale, and let those ribs move. So we got to get the rib cage and airflow moving to kind of unlock ourselves. And while you sit all day, I mean, to me, and I work with a whole therapist group here. We were kind of doing some things in tangent together, is even having the therapist and the patient do it with the therapist, right? Like, because most people we're seeing aren't coming in like, yeah, I don't have a care in the world. I'm feeling pretty good today. No, people are stressed out. We're always on. How do we get us to turn off? And you can even do that standing. So even in the same position, you would just tuck your bottom, push away, and breathe into the back. So called posterior mediastinum expansion. It's a great tool. So that I think that, anybody that sits could use. You could do it in the car. It's a concept, is what I always tell people. So
yeah, Kasey, wow, that is so amazing, because as you were kind of leading that, and then you were in that previous layout where it was just you on camera, I was doing it in the background, and I could tell the difference. I really could. I was doing what you said, like kind of just pushing out a little bit. And I do find myself kind of thinking about my posture. I'm like, oh, I need to sit straight. I don't want to slouch. I don't want to, so I'm constantly like trying to stay erect. But now, after hearing what you're saying, it's a good idea to like relax and just get a little slumpy, breathe. And as you were kind of directing us to think about filling up or breathing into the back, I was doing that, and it did feel, I did feel some relief. Like, I'm not even like exaggerating. Like I felt like a little more relaxed. I was like, oh, wow, that was a good breath,
Isn't that cool? Like,
that is really cool.
2 breaths, and that's literally what we see. Like, you're not making that up. You're not trying to, help me out by giving me some, we see that all the time. Yeah. So
yeah, I promise I'm not gassing you up. No, that was legit. And I really like what you did, or I'm sorry, the work you do. You were mentioning about working with therapists, and I think that's a really great idea, to be able to maybe walk through the client, for the therapist who's working with a client virtually, just do like some basic breathing exercises, just to kind of relax and get into the
Yes.
the session, or even just to help the client regulate if they're discussing a tough topic and it just
Right.
kind of, exacerbates some trauma or something comes out. That could be a
Yeah.
great way to help the client regulate themselves
Yeah.
by
One of
just
my
like,
favorites that's
yeah.
really easy because I see people virtually as well, is alternate nasal breathing. So and you can, there's research on this, but your right nostril is more your sympathetics because of where it goes to the left brain, and then your left nostril is more your parasympathetics. So when I was talking earlier about the nervous system and that cycle that we'd like to see, so even, I'll just have people, you can do this laying down or seated, but if we're doing it seated, I'll take us through this real pretty fast. I like people to find their left butt bone a little bit more than their right. And you can even, at home kind of think, wow, yeah, that is okay. Wait, I'm over on my left, but I still feel my right. It's like, can you let go of your right side? So once you find that left butt bone, I'll kind of have people, so another seated technique, stay over there on their left side. And you put your hand right in front of your face and you put your thumb on your right nostril and your pinky and your index on your left. And you'll close one and then you breathe in 4 seconds, pause 4, close the nostril, exhale out, pause 4, inhale in, close, exhale out the other side. And I'd have you do, I usually have people do about 6 cycles of that, but that's another great way to, I don't want to call it trick your nervous system, but essentially you're just getting that phasic motion back in the body that at once. And I personally do that one. If I ever have issues going to sleep at night, I'll just do that. And then all of a sudden I'm asleep within a couple minutes and didn't even remember that I wasn't, able to fall asleep. So yeah, I call them hacks, right? It's but that directly affects how the brain is perceiving itself and operating from a nervous system, anxiety or whatever is going on. So yeah, that's another great one.
Yeah, that's great.
For virtual. Yeah.
And it's really cool because something you said earlier stood out to me, and that is it gives the body what it wants, and that is that natural cycle that we talked about. So when you're breathing in and switching the nostril breathing, it really does let the body relax, it sounds like. And in your case, letting you fall asleep a little bit faster.
Right.
So
Right.
that's really cool. If somebody is kind of congested, Kasey, so I'm just thinking, like, if they're congested, can they still do the desk? Like, do they serve the same function, you think, like just as far as relaxation, or is one kind of better than the other?
Yeah. Well, if they're congested and alternate nasal breathing, that would probably be hard if they can't get air into one nose. So
Yeah.
on those kind of cases, I always recommend like people blowing their nose, maybe using some X Clear, which is a non-drug saline, right, to get that cleaned out. But depending on what's going on, right? But if they're saying prolonged congestion, then there's probably got to do something else to get that
Yeah.
that congestion down.
Yeah, and sorry, I meant to say, like, because I find myself even like one nostril will be a little plugged.
Yes,
You know
which
what I
is
mean?
normal. Yep, that's
Okay,
normal.
got
Actually, one nostril will always be a little bit more than the other. So we alternate our nostrils naturally.
it.
Um, and so, you hear people, oh, I have a deviated septum. And I'm like, it's called a pattern septum. It didn't deviate just
Mm,
because,
mm,
I don't rush and get it fixed because that's just a structural thing. We
mm.
want to actually work on the functional, like physiology about how air is getting in. It can still go up a deviated septum. So I always encourage people not to run out and get something done like that. But yeah, so that is normal to be a little bit clogged. But what you may find is the more you're getting into alternation, because when I'm talking about alternation, I'm talking about the body, but you have this whole cranial system and a
Mm.
sphenoid bone that those have got to move a little. And if those are moving, your flow is a lot better. But if you're
Mhm.
stuck, because I'll have people tell me time and time again, we have a sphenoid repositioning technique, and they're like, okay, all of a sudden I'm flowing, I'm draining now, like da 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 da. Is that normal? And I'm like, yeah, that's normal because you're stagnant and now you're not. So this kind of activity should improve prolonged congestion, as long as there's not something else, underlying going on, if that makes sense.
Got it. Yeah, and
So
I'm really
yeah.
glad that you brought up the the cranial
Hmm.
area, because I find myself, in some pretty tense therapy sessions, really
Yep.
clenching my jaw.
Yes.
And like at the
Yes.
end of the day, sometimes be a little sore even sometimes, especially if I have a
Yeah.
rough day and like it's just back to
Yeah.
back like rough topics with clients. We can't control that, right? We don't
Right.
control what the topics are going to be for the day,
Yeah.
generally. And so,
Yeah.
there be any like bad effects from having your jaw clenched like that?
Oh, good question. Over time, potentially. So,
Mm.
we have a course called Cervical Revolution that I'm actually training right now to teach for the Institute. And we talk about the jaw muscles. I'm going to grab my little other teaching prop here. But the muscles that you're talking about when we clench, there's your masseter. So that's a mandible elevator. And then here's your temporalis. And then you've got these muscles on the inside. They're here. They're called your lateral pterygoid and medial pterygoid, and they're who moves our jaw left and right. So when we start to, like you said, for creating tension in our body for stabilization, so a lot of times we'll overuse this jaw here when this neck, here's your C1 vertebra, sits right here, might be in an orientation position prolonged, that we'll use that jaw to try to kind of help stabilize ourselves. So the more that we can keep freedom in our body through our rib cage and through our neck, the less we have to rely on this jaw. But so that being said, when we are doing PRI techniques, we are directly affecting the jaw. The jaw to me is no different than an arm and a leg. What does that mean? Well, it's a extremity. It's got to move freely, because what it attaches into is called your temporal bone, and you got two, and those temporal bones move. So if that jaw starts to stabilize and our temporal bones start to get in positions that they don't unlock, there is long-term repercussions of that, if you don't have freedom. And I didn't even mention the dentition, right? You could crack a tooth, right, with clenching. But what I'm talking about is getting kind of locked up in the cranium. And so we
Wow.
do have techniques that we will, if someone is more driven, if you will, after you've tried the body stuff and their neck is still not letting go, we'll look more into this area. I work with a dentist. He comes to my office once a month, and we fabricate. I don't fabricate them. I help him deliver them, but splints for the mouth.
What?
I've probably delivered 3 or 4 a month. I would say not everybody needs dental integration. Everybody gets really crazy. Oh, I need this and I need this. And it's like, no, but there are people that do, right? That we get real trendy. We like Invisalign. I'm in Invisalign right now. We like pulling teeth to make room, or we used to. Um, Veneers or things that are changing our neurosensory input. And so when that bite starts to change, you better believe the first person to know it is your brain, because we're wanting feedback from those teeth, just like we do with the floor and the feet. Those are your 2 floors, if you will. And so quite often there are times that with someone's history that they can't downregulate without trying to use those teeth, or they have an open bite, or they have a cross bite, or they're missing 3 molars, or whatever the case may be. So that's when I phone my friend, and we will make splints so that if you clench and you do have bruxism.
All right, everybody, we're back. We lost a little bit of the signal. So sorry for the interruption, Kasey. So yeah, please continue with that great answer that you were providing us.
Yes. So, and I'm going to make sure that we don't have that happen again. So when someone is clenching, grinding, when we do the splint, if they do happen to do clenching, grinding, which I want to more figure out why we're constantly using our teeth for stabilization, but when they do, it's more of an even playing field. So we equilibrate the splint and make sure the body's neutral with it. And that's to help people sleep in it and wear it with activities too as well. So
Yeah.
it's a whole other side of PRI that I don't even talk about, because I work with an optometrist regularly too. I work with a podiatrist if we need to make inserts. And really all of those things, in a big nutshell, are just to help guide our clients, right? And to help give them maybe some referencing that they don't have within themselves at this point.
Yeah. Wow. That's
So
so interesting.
yeah.
Kasey, do you find that with somebody that has a pattern that's maladaptive, let's say, with their
Okay.
jaw, or they're
Yeah.
clenching on one side, or they're just always tense, whatever the case may
Yeah.
be, like, what are some of the effects of that? Like, just like, what can someone experience headaches and things like that? Like,
Oh yeah. Yeah.
Mhm.
Headaches, migraines, popping, clicking. Obviously you can have facial pain from something
Mhm.
like that, neck
Mhm.
pain. I mean, I've had I don't want to call it improper jaw mechanics, whatever you want to call it, tension, and they have pelvic floor dysfunction, right? So there's nothing is off the table, I guess is what I'm getting at.
Mm.
Visual instability. Do they have one eye overworking and they can't, let go of one eye? Did their optometrist put them in too strong of a prescription? I'm telling you, we could go really deep with this kind of stuff,
Wow.
but I see it all the time because all we're doing is looking at humans as if they're equal on both sides of their body. And
Mm.
that's the part when you go back to the baseline about where your assessment tool lies, whatever you're measuring, where is your starting format? And our starting position is we're not the same on our left and right side.
Yeah.
And I think if like more of the medical world and professions understood a little bit of that, and I don't considered it. I'm not trying to like put other people down. What I'm saying is the people that I see have been to 45 different doctors looking for answers. And it's like, no, it's an ear, nose, and throat problem. No, you need to go to the sports medicine specialist. And it's like, why can't we all come together and like work together, and we can resolve things together. We don't have to be in our boxes and be experts.
Yeah.
We just got to, have conversations across the paths.
Yeah.
So,
And it's so interesting that even somebody having a tense jaw, which they may not even be aware of, if that's can really lead to effects down the body. Like you mentioned, pelvic
floor.
issues. That is so fascinating.
Yeah.
And it's so crazy because like I said, I'll be in sessions and then I'll clench my jaw, and then on occasion I'll be like, oh wow, yeah, I'm kind of, and it just makes me wonder like how many times I'm not aware of it, or even during the sessions, I'm definitely not aware of it. So that's,
1,000%.
and that's kind of wild.
Right. So,
So
we'd further like think, okay, well, what can we do? Why is he overusing there? Right. Ankles. I always look at ankles. Anytime someone's complaining about neck or jaw, I'm like, what's going on at your ankles? Did you sprain an ankle? Did you hurt your ankle? Because those are your systems that have to work together for upright management. Right. And you're probably like, yeah, duh, I knew that. Right. But, so yeah, that's the big takeaway in all of that is we look at the whole body. We're never I'm not going to just put dry needles in your jaw. Like, why is he clenching? Where is his head? Is his head too far forward? How can we get him? But also even you mindful. A lot of people like you aren't mindful that they're clenching their jaw, So even as I'm watching you move your jaw, that's a great activity. It's called lateral pterygoid function, kind of moving and moving. That kind of keeps some oscillation in your body, right?
Yeah.
We have techniques that we do with that.
And Kasey, wow, that's so wild because I did have a pretty bad ankle sprain in the military.
Okay.
And it was pretty bad. And as you were talking about that, like, hey, first thing I would look at is the ankles. I'm like, that was me. I do have a really busted right ankle. So really, really interesting. And I have been trying to be mindful of my jaw positioning and like my tension.
Yeah.
Not because I like stumbled onto your work or anybody, like it's just like me being aware of it. And I was like, this doesn't feel normal. It doesn't seem normal. Let me just try to be aware of this. But I can just imagine somebody who's not aware at all, never experienced this, the PRI, excuse me, material. So really, really fascinating. Kasey, so what's on the horizon for you in your practice? Like, what do you have any like online courses? Can we join any classes that you're hosting? How does that work?
Yeah. So I currently teach for the Institute. So not that I'm limited in what I do outside of the Institute, but I don't have any like little pop-up courses. I have a mentorship and they've kind of taken it over on their own, but practitioners that are wanting to learn. A new therapist is about to start with me in a week. So, she is probably more creative than me in this world because I'm one of those, I go to work, I do my job, and then I'm studying and teaching around the country for the Institute. So I don't have a lot of flexibility in what I'm doing, for the general public. But on our webpage, on posturalrestoration.com, you could once again be busy with all the there's some free webinars of our founder, Ron, speaking. There's tons of free material. There's a YouTube channel. His name is Neil Hallinan, good friend. He's up in Jersey. A lot of people find us through his YouTube, and he does a great job of explaining this in a more layman terms way. And so I think he does an awesome job. So that's another free resource if people are like, okay, wait, I'm kind of interested in this. So our webpage is one great. And then I think Neil's YouTube is another great way to get more information. And then obviously taking a course, but it just depends on where you are in life and why you would, take the course and how you would use it.
Yeah.
So, yeah.
Gotcha. If somebody wanted to partner with a PRI, I don't know, specialist,
Yeah.
provider, I don't
Yeah.
know what the right term is,
Yes.
Kasey. But if somebody wanted to partner up, how does that work? Is there like a consultation? Do you guys offer that? What's kind of
Yeah.
the
Well, so depending on where you are in the country, we have a find a provider list on our posturalrestoration.com. So you go to find a provider, put in your zip code, and you can see kind of who's nearby. If no one's nearby, we have a list, and you can always reach out to the Institute. They are phenomenal at promoting, getting back to people education. I mean, that's really our job. We want to educate. And they can link you up with virtual. So how I work is I just see my clients one-on-one from that standpoint, on a virtual or in person. But that would be, for therapists who may be looking to either be seen themselves or to referral, the find a provider would probably be the best tool. And it's really user-friendly on our webpage. So
Got it. Yeah.
Yeah.
Kasey, wow, this was such a great conversation. I really appreciate you hopping on the show and sharing some of that with
Yeah.
us. What I do know about PRI is that we barely scratched the surface of your world, and
Yeah.
it's so fascinating. I've been diving in ever since you and I kind of talked a few weeks ago.
Oh, great. Yeah.
And it's mind blowing. And I share your sentiment when you're like, just totally, shifted my perspective on things, because it's so wild. Just like you mentioned earlier, the chains and how everything's connected, and you can have an issue up here and then like feeling it down in your ankle or in your pelvis, and our neck pain maybe as a result of something going on somewhere else, and it's just so freaking interesting, if I can keep it blunt, So I really
Well,
do
thank
encourage.
you. That means a lot to me. It really does. Because when you have a passion that you want to share with the world, and maybe there's some ears to hear it and maybe there's not, but you're doing the work every day and seeing the differences, and it's just really rewarding to have somebody that's like interested in it, or it's just appreciate it. And maybe that might be the right question. So thank you for having me, and it's great.
Yeah, absolutely.
So
Maybe we could do it again sometime next year and see where you're at with your career. Maybe we can bring something else to the audience.
Sure.
Kasey, thank you so much for your time. I appreciate it. And we wish you the best of luck.
Okay, great. Thanks.
All right. Signing out,
All right.
everybody. Bye.
Okay. Bye.